Hello, everybody, and welcome to the Sinclair Chatterbox, the show where we talk about what's on our mind, topics of the day, and our experiences. And I'm Mike Sorg, the director of web media here at Sinclair. And today we're going to talk about chiropractic pain relief. Did I use that right?
That is correct.
I found I was having issues using the word in the proper ways leading up to this because I never had to talk about it so much.
Absolutely. A lot of people do. But
so,
it is chiropractic pain relief, exactly, yes.
Exactly. Please introduce yourself for everybody.
My name is Don Valentine. I am a chiropractor, Palmer trained as Palmer College of Chiropractic. And I'm here to talk about how chiropractic can help people in various pain conditions find relief.
Excellent. I guess the first thing, what drew you to this line of remedy?
I think it was a natural progression through my college years. Having interest in sports medicine, I was introduced into a chiropractor's office to help myself personally, and it grew my curiosity, and from there it went. And off to school I went. It was either that or physical therapy, some sort of hands-on work anyhow, and one thing led to another, and to Palmer I went, and here I am now.
Excellent, excellent. So, as I say, we're going to talk about pain relief a little bit here. Tell us, you have a lot of people coming through the door here. You know, what sort of issues do you see? What's common amongst people looking for help from you?
Well, there certainly are the common presentations: the achy back, neck, shoulders, and then there are the not so common people with bizarre pain that they can't describe or hasn't quite been diagnosed, and they're not sure what's going on. We'll stick to the common things because it's easier to talk about, but you'll find that the way a chiropractor works to help people is pretty much, it's very similar, and the approach, looking from one condition to the next, has a very similar template. But how you work with a person can vary a lot between condition to condition.
Mm-hmm. And what all is involved with the process?
If you were to walk in the door today and you said that you had a pain, ache, whatever, an injury, we begin with a history. What happened? How'd you get to the condition you're in? What are this? Tell me the story of why you think you feel the way you do. That's followed by an examination, which is pretty traditional in the sense of how much can you move, what hurts, where does it hurt, how often does it hurt. If x-rays, MRIs, or other studies are necessary, that's included to create a diagnosis. One thing that's really important in any treatment is knowing what you're treating, and having a name for what your pain is absolutely vital to create the correct treatment path. Mm-hmm. So the examination creates the name of what we're dealing with, and then the treatment plan is obviously designed to reduce the symptoms. But in the chiropractic sense, you will always hear we're looking for the root of the problem, which sometimes is not necessarily the symptom that you came in with. For example, sciatica. You may say your foot is numb, your foot hurts, or your leg hurts. But in reality, the pain, the issue is not in the leg. It could be within the low back. So you work within the low back to help resolve the symptoms elsewhere. And there are many other examples of that, but that's one presentation example.
Mm-hmm. And then people, my interpretation of this method is a lot of massages, a lot of is back cracking a part of that.
Absolutely, that's the way it's perceived, right?
Okay.
You go to the chiropractor to get your back cracked.
Mm-hmm.
I
like to call it a bacchiotomy.
Well, however, I hear it all. The long and the short of it is hands-on work with the body. Mm-hmm. It means touching the body by working with muscles, tendons, ligaments, and the skeletal structure, which means you're actually pushing on the bones within the body. And sometimes, yes, you do hear the cracking. The crack sound is not a necessary component to feeling better. However, traditionally, that's what we're known for. Throughout all the ages that we've been around, you hear sound, but it's not a prerequisite to feel better. That's not the therapy. The sound isn't the therapy. It's finding the anatomy that is not working and getting it to work that helps resolve the problem that you came in with. And that is indeed the art of the profession, is finding what are those connections. Regardless of your presentation, is there something that is out of order within the body that can be moved, manipulated, placed, that can positively affect your condition? And indeed, so on the table, if cracking sounds are heard, then so be it. That's part of the process. But if somebody is really, really not in the mood to hear that out of their own body, there are different techniques for that.
Good.
So,
are there a lot of, we've talked in the past on here about Reiki, yoga, some other methods that are here at Sinclair, and a lot of the misconceptions going into it.
Sure.
What are a lot of things you hear, and what do you have as kind of an answer to some of those?
Well, let's start with what chiropractic is in a nutshell. And I believe we've heard in the past in discussing Reiki, the comment, the body can heal itself. And that's a vitalistic point of view of healing. When you think about how we look at ourselves from a traditional medical model, we're symptom oriented. We identify the pain and we go, ouch, that hurts. What's wrong and what can I do to manage that symptom? A vitalistic point of view looks at the body as, well, why isn't it repairing itself? Why am I continuing to hurt? Yes, this particular part may hurt, but what's going on behind the scenes somewhere else in the whole system that's causing this to hurt day in and day out over a long period of time? It's a change in perspective on how chiropractors look at the healing process compared to traditional medicine. Given that, some of the misconceptions are, well, I guess some of the ones are, once you go to the chiropractor, you always have to go. And that's not true at all. A treatment plan should have a start and an end with a goal in mind. And there are people who choose to do maintenance care at whatever frequency they choose, and however they want to come in. But there is not an endless cycle of treatment that has no aim. Any good treatment plan should have a beginning and an end. The other misconceptions with the cracking, do you always have to hear the cracking sound? I think I covered that, but no, you don't. A sacral occipital technique is just a fancy way of saying, yeah, we could work with your body without creating high force maneuvers on the body, pushing and twisting and turning, sort of like turning into the pretzel type moves. And there are many others. One chiropractor to the next, you could probably see 100 different ways of doing the similar thing. But misconceptions, I guess, if I just sort of cross the bridge with, as people bring them up to me, I try to cross the bridge. Mike, are there any that come to your mind?
None mostly. But one question I have, we talked about the back cracking. Is it the same thing happening in your back as is doing when I say crack my knuckles?
Absolutely. It's a cavitation. That's just fancy word of saying that there is gas released within a joint. And to make my point, it's not necessary to create a better condition. However, it's a nice little sound that indicates that something did happen. A lot of people say, well, I didn't hear it crack. Did anything happen? Well, yeah, something did happen. But specifically, the cracking sound is just a movement of gas within a joint. And if you notice, you might be able to crack your knuckle once, but then if you try it again, it won't make noise until it resets itself, and then maybe 5-10 minutes later you could do it again. But that's not the intended purpose of chiropractic, to just create sound or for that matter, make noise.
I think, if I'm not mistaken, I've heard in the past resistance versus chiropractic against medical diagnoses.
Right.
Like, say if you for instance, a personal experience. We were in a car accident several years ago, and my wife has had something that was not really easily diagnosed. I guess they call it soft tissue injury. And that's apparently it puts a giant asterisk wild card on whatever could be wrong with you. And we're not going to figure out you're not getting surgery, and insurance and the whole thing is a huge problem. I mean, you run into that a lot. Is this a continuing issue? Is it still seen in that kind of questionable light versus going to a doctor and getting that diagnosis?
Well, a diagnosis is a diagnosis. There is not a list that I operate out of that's different from the medical profession. What I come up with in terms of a diagnosis after an examination or diagnostic testing should be the same as what you would find out of the appropriate medical doctor's office, be it a orthopedist, family doc. And by all means, in my world, it's a sprain, a strain, musculoskeletal, something with your muscle, tendon, ligament, bone. That's primarily my world of diagnosing. You won't get a diagnosis out of me for an intestinal issue or a cardiac issue. Even though I may suspect it, that's not my scope of practice to go into that world. But regarding that soft tissue injury, sure. If that's what you heard in the medical profession, you may very well hear that out of my diagnostic list. But the way we would deal with it could be two very different paths. And maybe it all depends on what you were told to do. You might find that, wow, in a chiropractor's office, that same condition is treated a little bit differently, but ideally, obviously, with the same intent to make you feel better. And so it's a case-by-case basis, but soft tissue injuries are that condition that has the asterisks. And it's a shame because pain in soft tissue injuries is significant, but it's very hard to objectively prove. It means that you look good, the muscles feel right, but they hurt. And the question is why?
And you're the only one that knows that they hurt because you're the one feeling it. And it's kind of like,
Sure.
I know I hurt. Why can't you prove why I hurt? And there's that bit of a back and forth going on there.
Right. That's a common day presentation. I do get a lot of the people that come in to say, well, and I guess I have come to learn to take this as a positive, but I'll have people saying, well, you're my last resort. I've been everywhere, and then might as well try you. Well, thank you for coming in. And those are the fun people to work with because they have been down every avenue they can, finding limited relief or no relief. And it gives me the opportunity to do something new. And most of the time it works because outside of a symptom-oriented approach, if you're telling me only your neck hurts and that's where all treatment goes, then we're missing the bigger picture because your body is connected. Your neck does connect onto other areas of your body, which can, if you treat the appropriate places, result in a reduction of pain. It's a case-by-case basis as to how to deal with that. But the chiropractor doesn't just say, well, if you hurt on the upper side of your neck, that's the only place I'll treat. I'm going to treat the whole spine. I'm going to look at your whole body. How do you stand? What's your posture like? What do you do all day? Do you sit, stand? Are you physically active? There are so many different components and variables that can help in the healing process that the chiropractor may pay much more attention to than just the symptom-oriented approach by saying, well, you hurt in your neck. Here is something to decrease pain. Here is a medication to decrease inflammation. It certainly can be valid, but it's not addressing the bigger picture. And so the chiropractor, in those cases when I see that, I love it because it's like a puzzle. that piece by piece you begin to put the body together in a way that helps a person feel great.
It's like you're playing Operation.
Yeah, it really is. Sometimes by knowing the anatomy, you could begin what we'll call a kinetic chain. Mm-hmm. For example, when you walk, which muscle moves first, second, third, and how does your ankle relate to your knee, to your hip, to your low back, so on and so forth. If you understand the muscle movements and how they interrelate, you can help things distant from where you feel the pain. So by working at the hip, you could help with the knee pain or vice versa. Truly remarkable, and that's the puzzle that I enjoy. And when I work with somebody who is motivated in learning themselves, all the better. Mm-hmm. And maybe that's a neat little twist in terms of the treatment in the chiropractic sense. It really is a give and take in terms of communication. What you experience, what you feel, what you're capable of doing does guide me on how I work with you. If you're unwilling to do anything outside of a treatment session in terms of exercise, activity, posture change, it becomes a little bit more difficult on my side to create changes. But when you're on board, saying, okay, yeah, I'm gonna start paying attention to the little things in life. Wow. Now we're working as a team. We could give and take what works, what doesn't work. And if it were just a cookbook mentality of saying, oh, you got this problem, do this, oh, it would be too easy. But it's not. Everybody's different. So each plan and each little thing we do is individualized for what you feel.
It's more than just a Band-Aid on the situation.
Absolutely. In the ideal sense, it's really the correction of the problem. And be it an injury or some chronic event that sort of hangs out with you for the long haul, and you just want to find a way to deal with it. So you're right.
Of course, here at Seclair in Z Harmony, we have a lot of focus on, as we spoke before, say the yoga, the Reiki, alternatives to, say, the medication and the typical ways of overcoming mental issues or other physical issues. This really seems like, especially the wholeness of somebody learning the body. This is like can we think of this the same way as an alternative, obviously to pain medication, but to say surgery in some cases?
Well, that's a tricky question. Chiropractic care in a collaborative sense with other healing professions, I would never want to look at it as the alternative. Rather, it's the complement too.
Because some things surgery is needed for, obviously.
And that's my point. So if in an acute condition regarding mental health, severe depression, by all means, medicate the acute condition if it's vital to the person's health and well-being. Mm-hmm. The chiropractic work can occur at the same time, but would never advocate for, would never advise the person to remove themselves from a medication.
So it's never throw your pills away, do this.
Absolutely not, because medicine has a purpose. It absolutely helps in acute scenarios. Mm-hmm. But over the duration, the long haul, I guess the philosophical question is, does that need to be maintained? But that's not my job to ever guide somebody off of medications, as I'm not allowed to do that. My license doesn't allow me to advise you what to do with your medication. So it's really a personal journey that, as a patient, somebody needs to say, well, I'm interested in getting off of this. That discussion needs to happen with the prescribing doctor. So my role then becomes to complement the work that patient's doing, help them learn their body, talk with the prescribing doctor to say, well, should we do a trial of trying to pull off? And in doing so, maybe you can wean off. But to be very clear with that, it is not about me saying, no pills, no surgery. It's just not what I operate under. I can't prescribe it or perform it. But if I could keep your body moving, teach you how to keep it moving, Without those, then all the better from the very natural context of what chiropractic is about.
So if somebody wanted to find out more information, are there resources online?
Through ZHarmony or through the website at Sinclair, you could find out about me.
Here at Sinclair, how you can find about you through the website?
Correct. And should you want to make an appointment or speak with me, the number should be listed at the 724-539-1633. Feel free to call, ask questions, and you can meet with me here at ZHarmony. I'm here on Wednesdays. So you're welcome to call and ask away.
Excellent. And for those that aren't, say, in the Westmoreland County area here in Western PA, of course we're all downloaded all over the place. What's the best course of action, do you think?
To communicate with me.
With you or finding somebody in their area?
How to find somebody in their area. You pick up the phone. If you're really starting at a... You got to talk and you got to ask questions. The key point, in my opinion, is you want somebody who's going to look at you as a whole person. Most chiropractors do. That's sort of our job. We're holistic minded. But ask the questions. How do you work with people? How much time would I expect to spend with you? That's a big point of contention. How long do you actually have face-to-face contact? With me, it's pretty inclusive. Our first meetings are, 40 minutes to an hour, really learning about you. But, there are different models of practice. So I would advise people, if they're looking for a chiropractor, ask questions. Call up, make that initial consultation, and see what they could do.
Well, again, thank you for joining us here. I think it was a great talk. And if anybody wants to learn more, of course, we shared the phone number and everything at Sinclair.com. We'll see. If a lot of people have questions, we'll see about maybe bringing it back for a Q&A.
Absolutely. Glad to be here today.
Excellent. You can email me at mike@Sinclair.com. I'll pass along anything in your field, of course.
Sure.
And of course, we're on Facebook, so look up Sinclair there. Feel free to ask questions about anything we do here, and we'll forward along to the staff, or the staff, or a lot of them are on Facebook. They'll maybe answer you straight on there. And of course, thank you for joining us on the Sinclair Chatterbox. Please continue the conversation, like I said, on the blog, on the Facebook at sinclair.com/blog. You can leave comments right here in this post on that blog if you'd like. Until next time, we'll see you in the Chatterbox.